Good afternoon. Did you know that right now you have something in your intestines that could kill you? It is the bacterium Enterobacter aerogenes. E. aerogenes is a gram-negative facultative anaerobe found in animals, humans, water, soil, and sewage. A facultative anaerobe is an organism that can grow in the presence or absence of oxygen. E. aerogenes also belongs to a group of bacteria known as the enterics, and they reside in the gastrointestinal tract in humans. The presence of this bacterium as part of our normal microbial flora is beneficial to humans because it produces bacteriocins that can kill off potential pathogens. However, this microorganism can become an opportunistic infection that harms the host in specific situations. Opportunistic infections can occur when a person has a compromised immune system, removal of normal flora from the body, or a migration of E. aerogenes from its normal environment. E. aerogenes is a microorganism that lives in humans, so how is it able to harm us? The following virulence factors enable this bacterium to cause disease in humans. E. aerogenes has flagella and fimbriae, and they increase its ability to cause disease. Flagella allow the bacterium to move and propel itself away from harmful substances. The fimbriae function in attachment, so the bacterium is able to stay within the body. E. aerogenes contains an endotoxin which can cause fever, inflammation, shock, and damage to blood vessels. This bacterium also contains sex pili, and they can facilitate horizontal transfer of genetic material between bacteria. Antibiotic resistance genes can be found on plasmids, and they are easily transferred from one bacterium to another via sex pili. Now that we know some characteristics of E. aerogenes, what are the practical uses of this knowledge in the healthcare field? This microbe has the ability to cause disease due to its virulence factors, and we will now look at some infections that occur in the hospital setting. E. aerogenes can grow in several different types of environments, so it can be really difficult to prevent infection by this organism. Nosocomial infections are illnesses that are acquired while in the hospital, and this bacterium is a common source of these infections. Patients in the hospital already have a compromised immune system, so this microbe can easily infect sick patients. E. aerogenes has been proven to cause infections of the skin, respiratory system, and urinary tract, along with meningitis. Urinary tract infections are the most common type of nosocomial infection, and this microorganism usually enters the body via an indwelling catheter. Contaminated catheters and improper catheter insertion account for most UTIs. 20% of all urinary tract infections that occur in the hospital are caused by E. aerogenes. Patients who undergo a surgical procedure also have a high risk of developing an infection from this microbe. A study was conducted in 2010 monitoring 12 patients who underwent cardiac surgery. Of those 12 people, 15% of them developed post-surgery infections by E. aerogenes from their own gastrointestinal tract. This occurrence is a specific example of normal microbiota becoming an opportunistic pathogen due to relocation within the body. Antibiotic resistance is a growing medical problem because treatment options are limited once resistant strains of bacteria emerge. Within the last 25 years, E. aerogenes has become resistant to numerous classes of antibiotics. This bacterium has shown resistance to beta-lactams, chloramphenicol, fluoroquinolones, and first and second generation cephalosporins. Infections caused by this microbe are hard to treat when antibiotics are not effective, and sex pili are the major reason that microorganisms are able to develop antibiotic resistance. Now that we know E. aerogenes causes illness and it is resistant to certain antibiotics, let's discuss the ways to decrease the spread of infection within the hospital. There are 3 techniques that should always be used in the hospital. The easiest and most effective measure is for hospital workers to constantly wash their hands. The next way to decrease infection is to always wear gloves when dealing with patients. Another good practice is to ensure that all instruments and equipment are sterilized or properly cleaned. So remember, E. aerogenes usually has a symbiotic relationship with our body. However, this microbe can cause illness and death if our defenses are weakened. E. aerogenes is responsible for 7 different types of illnesses, and antibiotics are becoming increasingly ineffective against them. Bacteria will always be present in our bodies, so we just have to make sure that we stay healthy and keep them in their rightful place.